Hello, this is Alfred Poor, editor of Health Tech Insider, coming to you from the Digital Health Summit studios here at CES 2020. And I have the pleasure today of talking with Angelica Bruhnke. She's the CEO of Versatile Med Analytics. So I'm guessing from the title that it's got something to do with big data and healthcare.
Yeah, just a little bit.
Yeah. So tell me a little bit about what you do.
So really we are helping providers and payers succeed in a rapidly changing healthcare industry. A lot of that is driven by value-based care reimbursement structures and how that's evolving to put more of a challenge on how do you prove that you're providing better outcomes, whether you're managing a patient or a member population. So really what we do is we use that data to poise our payers and providers for success when it comes to a outcomes monitoring tracking perspective, because now you have to use data to really show results. So
traditional healthcare hasn't been outcomes based.
Right.
Do you find a lot of pushback and resistance to this change, and how do you help the providers and the deal with this and ease the transition?
Definitely see some resistance on the provider side because it's a completely new realm for them. So payers have been operating like this for years. They've had to manage member populations. Well, now the lines are starting to blur and providers are having to think like payers. Now they're responsible for entire populations that are attributed to them. And so they need to use data to really show that they are indeed providing better outcomes for the patients they're treating.
So what are the challenges in aggregating the data, cleaning it, making it usable, and being able to come up with actionable information from it?
Well, the challenges are also the blessing in that we have so much data. It's awesome that we have all of this data that we're now collecting, not just from EMRs and claims data, but now we have all of our digital technologies capturing data real time. The challenge is how do you aggregate all of that and how do you put it into a picture that's really painting that true picture of the patient's health.
So are you doing individual patient outcomes, or are you also doing population analysis?
At a population level, definitely, especially since these are the types of arrangements for reimbursement that providers are entering into with payers. So they're being responsible and accountable for managing whatever patient populations are assigned to them and having to use data for that entire population to really show how they're performing. And their reimbursement is contingent on that performance.
So where does this outcome-based healthcare lead us next? What do you see as the positive outcomes for us, and are there pitfalls in there that we should guard against?
The positive outcomes that we're already seeing is that we're already seeing an impact to how patients and members are being managed. Now that it's almost like payers and providers are now on the same side of the table, whereas before they were on opposite sides of the fence. And so now it's more of a collaborative landscape, and it's a new dynamic for both of them. But the impact we see is that initiatives are being developed, and the missing link is how are you tracking the success of those initiatives, and you need data to do that. So we're starting to see early results in effective use of these types of arrangements and initiatives.
Excellent. Are you seeing earlier diagnosis, earlier treatment, improved outcomes, and does this have an impact on costs?
Absolutely. So we're seeing earlier intervention. So when you look at patients that are driving costs, really, if you're proactively looking at these populations and looking at early indicators of where this patient is potentially headed for trouble. So your care management team can reach out early, develop a care management plan that's centered around either medication adherence or utilization of services that these members should be receiving early on before they become a not only problem patient, but a high cost patient.
Exactly.
Yeah.
Well, that's wonderful. It gives us some hope for improvement in the healthcare system. So Thank you so much for the great work that it sounds like you're doing.
Thank you.
Appreciate your time.
Absolutely. Thank you.
Once again, this is Alfred Poor, editor of Health Tech Insider, here at the Digital Health Summit studios at CES 2020. Thanks for watching.